Howdy y'all. I'm Dr. Jeff Jarvis back with another protocol review module. This one should be relatively short. We revised the nausea and vomiting protocol basically to add in a new drug. The new drug is Droparidol. Droparidol is possibly my favorite drug, very effective for patients with nausea, even more effective in patients who are vomiting, actively vomiting. So the protocol for our basics, clearly do the things you would normally do, position of comfort, think about keeping them in the recovery position, think about their airway, do those things. Suction if you need to suction to keep their airway open. Use isopropyl alcohol, the little alcohol cleaning preps. Turns out that used to be an old wives' tale about delivery. OB nurses would say this all the time, oh, just let them sniff some alcohol, they'll be fine. And we always thought that was a medical myth. Turns out, a friend of mine, Dr. David Wampler, did a study, a randomized controlled trial of isopropyl alcohol, snorting that, versus Zofran. For nausea, it worked just as well. I'm not promising you it will work, but it's definitely worth a shot. Give it a try. Now, if they're actively vomiting, it's not going to work. If you need to give them something else, give them 4 milligrams of Zofran. You can do it ODT. Or if you need to give it as an assist, give it IV. Give it IV. Zofran's great stuff. You can repeat it every 10 minutes if you need. Now, if you need something more than that, you can go with Droparidol. So we talked about Droparidol doses for agitation of 5 milligrams or 10 milligrams, cut in half for elderly patients. Well, we're going to start with a much lower dose for nausea because we want the antiemesis. We want them to not be nauseous, but we don't want to sedate them. So we're using a milligram or 1.25 milligrams here. Now, if you need to repeat it, go ahead and cut the dose down. That's 0.625 milligrams. And we don't need to decrease this dose for patients over 65. And the reason we don't is this is in the generally non-sedating range. So we're not as worried about over-sedation as we are when we're giving the big doses. Hopefully that makes sense. So again, Droparidol, 1.25 milligrams. If you need to repeat it at 0.625. Now, I understand getting 0.625 may be hard to draw up. Get it as close as you can. That's just do the best you can with it. It doesn't have to be precise. All right. Oh, the other thing is we have taken out IV fluids here. That does not mean that you can't give IV fluids. If you think the patient is dehydrated or for whatever reason would benefit from either IV access or IV fluids, give it to them. That's covered under the circulatory protocol. If you think they need oxygen, give it to them. We're not going to put that in every protocol. I trust you as clinicians to make that decision. That's nausea and vomiting. Thank you all very much.